drugs. Next, let's move on to sarcomas. Sarcomas cancer develops in the connective tissues, like bone cells, cartilage, muscles, and other soft tissues. For example, bone cancer, right here. Leukemias and lymphomas. Isn't the name obvious? Leukemias and lymphomas are red and white blood cells that are developed in blood cells. Formation of abnormal amounts of blood cells or red blood cells, leukocytes, leukemias. Leukemias and lymphomas are examples of blood cancer. Now, let's move on to the diagnosis of cancer. There are many different ways of detecting cancer, and some are still in development. But the most common way are X-rays, computed tomography or CT, magnetic resonance imaging or MRI, and PET-CT scan. They help determine the size, the shape, and the location of the tumor. Blood tests can also be used to find out the different types of blood cancer. Biopsy is the removal of a few cells from the body of the infected person, although it's not really a virus, and trying to determine the type of cancer, if it is malignant or benign. There are many different treatments for cancer, and some are still in development, same like the diagnosis of cancer. There are surgery, chemotherapy, and radiotherapy. Surgery is the I guess like easiest, hardest one. It's to remove the tumor directly from the body. So like you cut it open and you grab it out. Chemotherapy is to destroy the growing cells using lethal drugs. It's not the kind of drugs you receive in death row. It's controlled, but there's a downside to chemotherapy. It kills healthy cells in the process. I'll be going on the topic of chemotherapy in a future video. And the last type, radiotherapy. It's to destroy the tumor cells using different types of radiations. High doses of radiation